Hi guys, this is Nanda, and today for my sports injury webinar, I will be talking about shoulder dislocations and going more into depth with its mechanisms and treatment. So firstly, for us to understand shoulder dislocations, we need to know about the shoulder joint. The shoulder joint is also known as the glenohumeral joint because it consists of the head of the humerus fitting into the glenoid cavity of the shoulder. So the shoulder joint consists of three bones: the clavicle, the humerus, and the scapula. This type of joint is known as the ball and socket joint, and it is the most mobile and offers a huge range of motions. But one of its downsides is that it is very unstable and therefore very easy to dislocate. The whole joint is covered with rotator cuff muscles, and as you can see here, the ball and socket joint allows wide range of movement. Here you can see the ball and socket joint more clearly. The head of the humerus fits into the cavity, and dislocations occur when this humerus pops out of its cavity. And due to the fact that the joint allows so many different movements, the dislocation is very easy to occur. The joint is covered with rotator cuff muscles, and there are four muscles in the rotator cuff, and all these contribute to different movements of the arm. The subscapularis is responsible for the medial rotation of the arm. The supraspinatus is responsible for the abduction of the arm, and the teres major and the teres minor is responsible for the lateral rotation of the arm. Another function of the rotator cuff muscle is that it helps to stabilize the glenohumeral joint. Basically, when the head of the humerus dislocates, the glenoid and the ligaments in the front of the shoulder are often injured. The cartilage rim around the edge of the glenoid may also tear. There are many factors that could cause a dislocation. I will be going through the most common of these causes. The first cause is known as the traumatic shoulder dislocation, and this occurs when the shoulder is in a very awkward position and is dislocated with a very high speed, for example during a football tackle or maybe a very bad fall. The second cause is known as a repetitive shoulder ligament overstrain, and it occurs in people with looser ligaments. The looser ligaments makes it easier for shoulders to dislocate due to the shoulder becoming more unstable, and this happens because of the repetitive use of the arm, most likely because of sports such as swimming, tennis, cricket, or baseballs, any sports that involves the movement of the arm. The looser ligaments makes it harder for the shoulder's rotator cuff muscles to maintain shoulder stability. In the case of multidirectional instability, your genetic disposition comes into play. Some people are just born with looser ligaments, which makes it more easier for them to dislocate their shoulders. There are two types of dislocations. Subluxation, or partial dislocation, as the name suggests, occurs when the head of the humerus is partially out of its glenoid socket. In this case, the shoulder can pop out in many directions or in one direction, anteriorly or posteriorly. The pain is not very severe and in this case not very serious, but it can be quite disruptive for daily activities. The second type of dislocation is complete dislocation, in which the shoulder is completely out of its socket. This case is more serious and the pain is very severe and more measures will have to be taken for treatment. In this first picture here, we can see how a normal shoulder joint would look like. The head of the humerus is perfectly placed in the glenoid cavity of the scapula. However, in the second picture, we can see posterior shoulder dislocation, in which the shoulder joint is dislocated towards the back. So we can see here that the joint is behind the scapula at the moment. And this third picture shows anterior shoulder dislocation, in which the shoulder joint is dislocated towards the front. So the joint over here is right in front of the scapula. Here we have x-rays of shoulder dislocation. As you can see here, there is quite a gap between the head of the humerus and the cavity. So here we have the X-ray of the anterior dislocation in the sagittal plane. The dislocated humeral head is located anterior to the glenoid and inferior to the coracoid process. So how do we treat this horrible injury? Treatment should be sought right away after the dislocation due to the fact that the joint will get more swollen and painful with every passing minute. The doctor will most likely move the arm bone back into its rightful place in the shoulder socket. Once the arm bone is back in its place, most of the pain will go away. After the shoulder has been repositioned, you would need to ice your shoulder for about 20 to 30 minutes every day for around 2 or 3 days. Or a sling or a shoulder immobilizer could be used to prevent further injury or unnecessary movements. Anti-inflammatory painkillers could be used to tone down the swelling and the pain. However, these painkillers will have its side effects. Sometimes surgery would have to be performed due to the fact that the lumbar ligament in the shoulder is torn. In order to regain shoulder stability after a lumbar tear, an outpatient surgery to repair the shoulder joint is most likely recommended. After the surgery, you would have to go through a series of physical therapies in order for the shoulder to work its full function again. So that will be all for today. Thank you very much for watching my webinar, and I hope you have gained some knowledge from this.